Hi, I'm Dr. Steven Krueger. I'm a Mohs micrographic surgeon and cosmetic dermatologist, and I spend most of my day surgically removing skin cancers. So I'm here today to educate you more about skin cancer and ways to prevent it. So skin cancer is extremely common these days. Some studies show that 1 in 5 Americans will develop a skin cancer by the age of 70, and there are more skin cancers diagnosed in the US than all other cancers combined. So it's extremely common. We're seeing a ton of it, and our goal is to really educate people to prevent skin cancers and to treat them as early as possible. So patients and friends and family always ask me what they should be looking for on their skin that would raise concern enough to go visit a dermatologist. Skin cancers can present any number of different ways. Often it presents as a single spot, sometimes a pink bump, or even a skin-colored, or we sometimes say pearly bump on the skin that just doesn't seem to be acting like other spots that you've had for a long time. So certainly anything that's growing in size, anything that's symptomatic, it's becoming itchy, it's bleeding, any kind of symptom like that would warrant you visiting a dermatologist and having a spot evaluated. For moles specifically on the skin, there is a memory device that the American Academy of Dermatology has presented to the public called the ABCDEs of melanoma. And it's a way to remember different kind of red flag features in a mole that would cause you to reach out to a dermatologist to have a lesion evaluated. So the ABCDs are asymmetry, border irregularity, color variation, diameter greater than a pencil eraser, and evolution. So if a lesion is asymmetric, if the borders are irregular or jagged, if there are multiple colors within a mole, for example, black, brown, and a pink spot, if the diameter is greater than a pencil eraser, and E, evolution, if that spot is changing, I think is the most important kind of red flag sign to remember, not only for melanoma, but for any of the different skin cancers. That would be cause for calling a dermatologist and getting in as soon as possible to have a lesion evaluated. So when we think about skin cancer and how common it is, we have to be talking about prevention. And the main way to prevent skin cancer formation is to be safe with sun exposure. We know that sun and ultraviolet rays from the sun are the key driver of skin cancer. So protecting yourself from the sun is the most important part of prevention. Now, of course, we want people wearing their sunscreen, reapplying it, wearing hats and sun protective clothing, avoiding, the peak hours of sun exposure right in the middle of the day, seeking shade, especially during those hours. And then it goes without saying, really don't ever want people using indoor tanning beds. There's lots of good data showing that indoor tanning bed use significantly increases the risk of all types of skin cancer and skin aging. So indoor tanning is out, but going to the beach, going outdoors, I still tell patients all the time, I want them to go enjoy their lives, just to do it in a safe way to reduce the amount of basically DNA damage that the UV rays are causing. So, I still go to the beach, I get under the umbrella, I get the kids coated in their sunscreen and long sleeves and hats, and then you can still enjoy being outdoors. So in addition to prevention with good sun protection techniques, it's also possible to actually reverse a lot of sun damage and precancerous skin damage at the dermatologist's office. So we have a lot of tools at our disposal to wipe away the UV damage. There are different topical medications that can be used for this purpose. There are some procedural options. For example, we have a blue light treatment called photodynamic dynamic therapy that does a fantastic job of clearing up sun damage. We have lasers at our offices that are used mostly for cosmetic purposes in terms of reducing fine lines and wrinkling and skin aging. But we have found with some studies that it does actually reduce the rate of new skin cancer formation by doing one of those resurfacing lasers. So lots of different options, and I would encourage anyone to talk to their board certified dermatologist or dermatology provider about ways, again, to reduce the amount of sun damage that the face or neck or other parts of the body have seen. And again, with the goal of reducing new skin cancer formation that would require more aggressive treatments. So another question I get very commonly from my patients, both skin cancer patients and cosmetic patients, is what to look for in a sunscreen. And really, there are so many hundreds of different brands of sunscreens out there. You really just want to be using the one that feels good on your skin with a few key features. It does have to be broad spectrum. Most in the US are now broad spectrum, meaning they fight UVA and UVB rays. I do want it in SPF 30 or higher, and really ideally they make sunscreens all the way up to an SPF 50, 70, or even 100. Studies have confirmed that the higher the SPF, the better the sun protection factor. There are differences in the sunscreens. There are quote-unquote chemical sunscreens and mineral or physical sunscreens. Honestly, there are pros and cons to each of those, and it's really whatever, again, feels good on your skin, and the one that you're going to wear consistently is what I would prefer. So I'm frequently discussing home skincare regimens with my patients, and of course sunscreen is the mainstay of every skin regimen, but there are other ingredients as well that have their place in terms of their cosmetic uses and also, again, reversing sun damage. So that would definitely be something to discuss with a dermatologist at a consultation appointment. So there are three things I want everyone to take away from this session. Number one is practicing sun protective behaviors every day of the year. That means wearing your sunscreen, wearing protective clothing, seeking shade, of course, avoiding indoor tanning beds. Number two would be keeping a really close eye on your own skin for any lesion that may be new or changing or symptomatic, and calling right away to have that spot evaluated. And then finally, I would recommend seeing a dermatologist at least once a year, just in terms of your overall skin health. Dermatologists are the experts in skin and can often find concerning lesions well before anybody else can. Well, thank you so much for attending this part of the session. Please stick around for our live Q&A session where I'm around to answer any question you may have.